Namaskaram, welcome to the Pharmacy discussion. It's a channel for discussing topics related to pharmacy lectures, news updates, competitive exams, and also health and drug awareness to public. If you like to watch such videos, please do subscribe. Now I am here for introducing 50 questions and answers selected from the important topics of pharmacology. I think it is very helpful for those who are preparing for the pharmacy related competitive exams. Please watch the video till the end. Answers with necessary explanations are also included. Okay, then let's check out the questions. First question, dimercaprol is also called. Answer BAL, that is British anti-Lewisite. It is a medication used in the treatment of poisoning by arsenic, mercury, gold and lead, which is given by an intramuscular injection, and the common side effects include high blood pressure, pain at the site of the injection, vomiting and fever. Second question, an example for semi-synthetic antibiotic is. Answer phenoxymethylpenicillin. Phenoxymethylpenicillin, that is penicillin V, and benzyl penicillin, that is penicillin G, are both produced biosynthetically from Penicillium chrysogenum by fermentation. Phenoxymethylpenicillin is an orally active penicillin used in the treatment of mild to moderate infections of the respiratory tract, skin, soft tissues, etc. Third question, drugs used for the immediate symptomatic relief of cough are called cough suppressants. Next question, drugs which dilate the pupil of the eye are called Diuretics. They are commonly used during eye examination and surgeries. Fifth question, metronidazole is a drug of choice for amoebiasis. Procaine HCl is a local anesthetic drug. Procaine hydrochloride is also called Novocaine. It has a similar onset of action but short duration compared to other local anesthetic drugs. 7. D-tuberculin is used as a skeletal muscle relaxant. It is given intramuscularly or intravenously as a skeletal muscle relaxant to secure muscle relaxation in surgical procedures without deep anesthesia. Next question, a natural androgen secreted by the testes is testosterone. Ninth question, parenteral antidote used in the copper poisoning is D-penicillamine. 10th question, isoprenaline as inhalation is used in the treatment of bronchial asthma. It is an effective bronchodilator when administered as inhalation, and the mechanism of action may relate to stimulation of beta-adrenergic receptors with relaxation of bronchial smooth muscles. And orally, isoprenaline is used in the treatment of bradycardia, that is slow heart rate. Next question, sodium valproate is used in the treatment of epilepsy. Sodium valproate is also called valproic acid. It is highly effective in petit mal epilepsy or absence seizures, and it is ineffective in focal cortical epilepsy and temporal lobe epilepsy. And I have one more point, it is completely absorbed after oral administration. Next question, the mechanism by which the non-steroidal anti-inflammatory agents act is by preventing synthesis of prostaglandins. The prostaglandins are a group of lipids made at the site of the tissue damage or infection that are involved in dealing with injury and illness. They control processes such as inflammation, blood flow, formation of blood clots, etc. 13. Parkinsonism is due to the deficiency of dopamine in the brain. 14th question, methyl salicylate is applied locally as a counter irritant. 15. An example of long-acting sulfonamide is answer sulfadimethoxin. It is an antimicrobial agent and is used as a veterinary medicine for the treatment of various infections. Next question, glucagon is used as a substitute for anticholinergic in radiological examination of GIT, that is gastrointestinal tract. Next question, a sulfa drug that is widely used to treat ophthalmic infections is sulfacetamide sodium. 18. Terbutaline is a beta-2 receptor stimulant used in the treatment of bronchial asthma. Then 19. The most effective single chemotherapeutic agent used in the treatment of TB is streptomycin. Next question, a substitute for morphine drug is answer meperidine. It is also called pethidine. Meperidine belongs to the class of opioid analgesics and is similar to morphine. It is used to reduce moderate to severe pain during and after surgeries. 21. An example for parenteral anticoagulant is heparin. 22. A drug used in the treatment of grand mal epilepsy is phenytoin. Phenytoin is a hydantoin derivative, that is diphenyl hydantoin. It acts by normalizing the lower threshold for seizures or by reducing sodium concentration in brain cells, which leads to decrease in post-tetanic potentiation, that is PTP. And I have one more point, it is well absorbed after oral administration. (23) A local anesthetic drug that produces vasoconstriction is cocaine. 24. Another local anesthetic agent used as an antiarrhythmic drug is lignocaine. In addition to the local anesthetic and antiarrhythmic properties, lignocaine also has analgesic, immunomodulating and anti-inflammatory properties. 25. Noradrenaline is synthesized in the neuron from tyrosine. Noradrenaline is also called norepinephrine. It is synthesized in the neuron starting with the amino acid tyrosine, which is obtained from the diet and can also be synthesized from phenylalanine. Actually, noradrenaline is included in the catecholamine family that functions in the brain and the body as a hormone and neuron transmitter. (26) Carotene is a provitamin of vitamin A. That is the most common type of provitamin A is beta-carotene. And of course, vitamin A is a fat-soluble vitamin and is also called anti-ophthalmic vitamin. 27. Absorption of tetracycline is decreased by milk due to chelation. That's why tetracycline is recommended to taken on an empty stomach. Drink a full glass of water with each dose of tetracycline and do not take tetracycline with food, especially dairy products such as milk, yogurt, cheese, etc. It is used to treat infections caused by the bacteria, including pneumonia and other respiratory tract infections. 28. Pharmacologically, cyclopropine is classified as general anesthetics. Okay, then next question. The oral contraceptive preparations contains a mixture of estrogen and progestin. Then 30. Sympathomimetic drugs mimic the action of adrenaline. Adrenaline is included in the catecholamine category of the sympathomimetic drugs. Adrenaline is synthesized in the adrenal medulla, and the parent compound for the synthesis of adrenaline is phenylalanine. Then parasympathomimetic drugs mimic the action of acetylcholine. Acetylcholine is included in the esters of choline category of cholinergic drugs, or otherwise called parasympathomimetic drugs. Prostaglandins are used in peptic ulcer due to their ability to prevent ulceration and bleeding from gastric mucosa. 32. The major unwanted effect produced by chloramphenicol and amidopyrin is aplastic anemia. Actually, in man, chloramphenicol induces two major hemotoxic effects. First one is reticulocytopenia and anemia developed during treatment, and the second condition is aplastic anemia developed weeks after treatment. Amidopyrin is also called aminophenazone, aminopyrin and pyrimidone, which is a pyrazolone derivative with analgesic, anti-inflammatory and antipyretic properties. Then its major side effects include blood dyscrasia and aplastic anemia. Next question, pharmacologically, hamycin is included in the class of antifungal antibiotics. Okay, then next question, tolbutamide is used as an oral hypoglycemic agent, that is for the treatment of non-insulin dependent diabetes mellitus. 35. Methotrexate is an anti-cancer drug. It is an antimetabolite and is included in the folic acid antagonist classification of cancer chemotherapy. Then the next question, when one drug enhances the action of another drug, it is called synergistic action. Okay, next question, captopril inhibits which enzyme? Answer, ACE. Captopril is an orally active inhibitor of angiotensin converting enzyme, that is ACE, which is widely used as an antihypertensive agent. Other drugs included in the ACE inhibitor classification of antihypertensive drugs are enalapril, lisinopril, ramipril. 38. Allopurinol acts by inhibiting xanthine oxidase. 39. Acetazolamide acts as a diuretic by inhibiting the enzyme carbonic anhydrase. Next question, chlorothiazides is used clinically as diuretics. Based on the mechanism of action, thiazides are included in the inhibitors of tubular reabsorption category in the classification of diuretics. 41. Glibenclamide is a potent oral hypoglycemic agent. 42. A purine antimetabolic used in the treatment of cancer is mercaptopurine. That is, mercaptopurine is used in the treatment of acute lymphocytic leukemia, which is a type of cancer that begins in the white blood cells. Next question, passage of drugs from the route of administration to the systemic circulation is called absorption. 44. A calcium channel blocker used in angina pectoris and cardiac arrhythmiasis is verapamil. And 45. The transport of drugs through a membrane by passive diffusion is proportional to the concentration gradient. That means the rate of diffusion is directly proportional to the concentration gradient across the membrane. Next question, a narcotic analgesic used in postoperative pain is morphine. 47. Neuromuscular blocking agent act by blocking the effect of acetylcholine at skeletal neuromuscular junction. 48. Lignocaine is a local anesthetic. 49. Pyrazinamide is a bactericidal drug used in the treatment of tuberculosis. And the last question, the anticoagulant action of heparin is blocked by protamine sulfate. Alright, I have completed the 50 questions and answers. If you like the video, please give a thumbs up and just comment below if you have any questions. And don't forget to hit the subscribe button. Stay connected. Thank you so much.